All right, let's talk about something that every single one of us in healthcare dreads, that moment that makes your stomach drop. Discovering a clinical alarm was missed. Today, we're going to lay out a super clear protocol for what you need to do, not just to protect your patient, but to protect yourself, too. So here's our game plan. First, we're going to get to the root of the problem, the chaotic environment that even lets this happen. Then we'll talk about the stakes involved, which are incredibly high. After that, I'll walk you through a step-by-step action plan for charting. And finally, we'll cover the core principles that keep everyone safe. To really get why a critical alarm can just vanish into thin air, you first have to understand what it's competing against. And honestly, it's competing against a sheer wall of sound. I want you to think about this number for a second. Research shows that a single patient, just one, can set off almost 190 audible alarms in a single day. Now multiply that by a whole unit. It's an absolute sensory overload for anybody trying to work in that environment. And what happens when you're hit with that all day, every day? You get something called alarm fatigue. It's a real, dangerous condition where your brain just starts to tune it all out. It becomes background noise, which makes it terrifyingly easy to miss the one alarm that actually matters. So what is going on here? Why so many alarms? Well, get this. Studies have found that somewhere between 85 and 99% of these alarms don't require any clinical action at all. They're false positives. And the main reason for them is surprisingly basic. It really comes down to that old computer science saying, garbage in, garbage out. The quality of the information you put into the monitor directly dictates the quality of the alarms you get out of it. If the setup is bad, you're going to get a never-ending stream of useless alerts. And this is where it gets kind of crazy. We're not talking about complex, high-tech mistakes. Audits show that up to half of all ECGs have major lead placement errors. For example, just placing the V1 and V2 leads a little too high can create artifacts on the screen that look like a serious cardiac problem, triggering a whole waterfall of false alarms. Okay, so we've set the stage. We have this noisy, overwhelming environment that's causing this alarm fatigue. Now let's zoom in on the moment it all goes wrong, when that fatigue leads to a critical event for a patient with life or death consequences. And I'm not being dramatic here. The stakes could not possibly be higher. When a real, actionable alarm gets lost in all that noise, the result can be a preventable tragedy. It can become what we call a sentinel event, a massive failure in patient safety, and that's something no one ever wants to be a part of. This quote, wow, it just hits you right in the gut. In a case that got a lot of attention, investigators found out that there were multiple, totally legitimate low heart rate alarms right before a patient went into a fatal cardiac arrest, and nobody remembered hearing them. It's just a brutal reminder of how dangerous this desensitization can be. And this is exactly why we're talking about this. That documentation you do after a missed alarm, it is not just busy work. It is an absolutely critical tool. It helps us spot safety risks, it protects you from legal trouble, and it helps the hospital see trends to stop it from happening again. It protects your patient, it protects your license, and it protects your coworkers. Okay, the worst has happened. You just found a missed alarm. First thing, don't panic. There is a clear, defensible protocol, and we are going to walk through it right now. Look, before you even think about touching a keyboard, your number one job is the patient, period. You follow these 5 steps in this exact order. Figure out what was missed, lay eyes on your patient, assess them, and make sure they're stable, and then notify the right person, like the RN or the provider. Only after all of that is done do you move on to charting. All right, patient's stable. Now we can chart. And I want you to think of this as defensive documentation. Your note needs to paint a complete and accurate picture. That means you include the time the alarm actually happened versus when you found it, exactly what you found when you assessed the patient, and a clear record of who you told, when you told them, and what they said. This note is a legal document, and it proves you responded professionally. So let's look at a perfect textbook example of how to do this right. Notice how it's totally objective, it's just the facts. It clearly states what happened, what was done, how the patient was doing, and importantly, why the note is a late entry. This right here is the gold standard. Okay, let's wrap this up and really lock it in. We're going to cover the big do's, the principles that should always guard you, and just as important, the absolute critical don'ts that you have to avoid. You need to think of your charting as a direct reflection of your professional integrity. That means you are always honest, you are always objective, and you are always timely. And on the flip side of that, there are some things you just never, ever do. Don't start blaming the equipment unless you know for sure. Don't go back and try to change or delete old notes. And please, do not guess or speculate about what might have happened. That is a recipe for disaster. So, if you only take one thing away from all this today, let it be this simple mantra. It's your North Star. Be honest, be objective, be timely. If you follow that principle, you're ensuring the best care for your patient, and you're giving yourself the strongest protection possible. Accuracy is your absolute best defense. All right, that's our look at this super critical topic. I really hope this gives you a clear game plan for handling what is a really tough situation. For some more great resources, including our EKG Survival Pack, make sure you click the links in the description. Thanks for joining us.